Senator Dr. Bill Cassidy joins us now. Good morning, sir. How you doing?
Hey, good morning. I like that, man. Burying a potato in the backyard.
I would.
So,
Wouldn't you?
Yeah, I do a lot of things, I suppose. We got to get back to normal. I'm with you.
Whatever it takes. Let's talk about wearing a mask. The vice president not wearing one at Mayo yesterday. Maybe it's excruciating minutia. Maybe it's not. Wear a mask. Don't wear a mask. Somebody texted in and said, well, if you think about it, when all of the officials are at the White House, nobody there is wearing a mask. The reporters are not. The vice president had been tested for coronavirus and it came up negative. So is this all a tempest in a teapot? Was there any reason for the vice president to wear a mask? Should we all wear masks? You're a doctor. You're a senator. You tell us.
First, the vice president was being nuanced. He was not positive, and everybody else was wearing a mask. In that setting, there's no additional protection by him wearing a mask.
Okay.
So we have to think about it. Now, that said, most people don't know their immune status, and most people are not in a setting where everybody else is wearing a mask.
Mm-hmm.
But when I went to Home Depot, a lot of people wearing masks. Some weren't. Some of them were pretty obese, which means that they are at higher risk of having problems should they be infected.
Mm-hmm.
On the other hand, they were staying 6 feet from everybody. So it's still kind of like figure it out on your own, but there are some guidances you can do in your personal life that give you, how much risk you want to take and how much freedom you want to have.
Yeah, that's a balance, and we had a fascinating conversation. I think it was with Betsy Stevenson about a balance between economic factors and human lives, and they call it the value of statistical life. I'm sure you're well aware of all of that. They're talking about unemployment rate now, 25%? For my grandparents, the Great Depression was their defining moment. It changed their lives, and Senator, it's probably the same with your grandparents, where that was their frame of reference. And during that Great Depression, the unemployment was about 23.9, something like that, percent at the height. If we're talking those kind of numbers, I don't know where we go from there. Am I making stuff up in my head? Am I being hyperbolic here?
That is certainly a risk. But the Great Depression lasted for 3 years.
Mm-hmm.
And so we hopefully will have this through by the end of summer. And now our goal is to support individuals and families, and I'm trying to also support government as they provide essential services like fire, police, and sanitation, so that when we come out of the COVID lockdown, we reopen and everybody's employed once more. We don't want that 3-year kind of period where the San Diego Zoo is shooting lions and feeding the meat to the people of San Diego because, one, they were hungry, and two, the city couldn't afford the lions. We're trying to avoid that.
Wow. So how do you see this whole thing unfolding? First of all, in terms of, I guess, the next stimulus package, some more disagreement. Well, I guess before you can talk about stimulus package, you have to talk about reconvening, because now the House physician or somebody is talking about not reconvening on Tuesday. Where does that stand, the business of the Senate and the House, in terms of y'all being back in Washington?
The House is not coming back in. The Senate is. Frankly, it's easier for the Senate. There's only 100 of us,
mm-hmm.
And we have bigger offices, and, it's just not as cramped. We have the ability to come back and maintain social distancing, and I'm sure people will be wearing masks when they're in public. The House, again, there's 435 of them, and et cetera. So it's easier for us to maintain social distancing on the Senate side. On the other hand, I am in favor of returning. If we can do it safely, I think we can. We should return. One, we're spending a lot of money, so we should definitely talk about that. Secondly, the president needs some appointees that are going to help fight the coronavirus. Those have to be confirmed by the Senate. We need to do that as well. Give the administration the tools they need. So for several reasons, would I rather be in Louisiana? Yes. No, I'd rather be doing my job, so I'm willing to go back.
So what is that going to entail? We take a break early here for traffic. We'll pick it up when we come back, so you have some uninterrupted time. What is the target, Senator? What are you guys looking at next? I guess there's going to be another round of stimulus. How likely is it that you're going to get across the aisle support on this? Everybody's going to work together. What about debt deficit? A lot of questions for you when we come back. 8:49, time for traffic on WWL. 8:53, 7 before 9. Tommy Tucker, WWL, talking to Senator Dr. Bill Cassidy. So, Senator, we have this conversation all the time. We talk about debt and deficit. I think for the first time in a long time, if ever, the debt has overcome the gross domestic product. Can we worry about that now? How do we proceed? What about vaccination, antibodies, stimulus, small businesses? A lot of problems. Jump in where you like, Senator.
Yeah, so let's just start with the debt and deficit. Of course we have to be concerned about it. On the other hand, the only thing worse than what we have now would be a Great Depression. You described your grandparents going through, and my parents, when they were children, going through a 3-year Great Depression in which unemployment was at 25% for 3 years, in some areas even greater. Louisiana was particularly hard hit. The only thing worse is a Great Depression, and that's what we are attempting to avoid. There is a way out of this, though. If you look at the Louisiana Department of Health website and you click on the COVID-19 little icon or space they have down there, kind of lower left, it brings up a map of the state and the number of cases within each parish. If you then click on an arrow, the lower right-hand corner of the map, again, it's ldh.la.gov, it takes you over to a census tract, which is kind of a collection of neighborhoods within each city. You can magnify that. You'll see in Jefferson Parish and Orleans Parish, and you name the parish in any parish in Louisiana, there are hot spots, which is to say there are hot spots within the hot spot. If New Orleans area is a hot spot, within the New Orleans area there are hot spots. And so I say that because I think that is key to reopening the economy and saving lives. To the degree that we go in there and on a voluntary basis ask people to be tested, and if they are infected and they're living with 6 other people, we give them the option of going someplace to be quarantined because Congress has given the states and cities money to help them pay for this. And you provide them with the food, you provide them with the room, you provide them with the medical services so that their health is protected, but they don't infect everybody else in their household. We more quickly bring down the incidence of disease and reopen our economy. Now, that's great. We're saving lives. It's all voluntary. We're saving lives. We're saving other people from getting infected, and we more rapidly bring it down. That's what they've done in South Korea. That's what they're doing in Germany. Those are the democracies with the greatest success. We need to learn from what other people are doing.
So how do we go about making that happen?
So the president just put out a testing plan yesterday called the Blueprint. And I actually had a phone conversation last night with the head of the Centers for Disease Control, if they would want to partner very fully with the state of Louisiana in attempting to implement this. Of course, they're giving guidelines. In our state, I texted with Governor Edwards this morning to tell him about this conversation. He's very open to it. I've been texting with people in New Orleans. They are open to it. How do we, though, take these resources, that everything we need, fully implement in our cities, in our state, so that we can help those people in the hot spots within the hot spot. But by the way, by doing so, we decrease the spread of disease, reopen the economy. And so I have a contact. The director of the CDC said, I'm with you. The governor said, let's do it. So I'm hoping we go forward from here.
So again, this would be a voluntary testing of which people?
So you go into the city of Jefferson Parish, for example. There are census tracts within JP that have a higher incidence of disease and which have more people living there who are at higher risk of disease, obesity, high blood pressure, diabetes, you name it. You focus your testing in that area, figuring out how to reach as many people as possible, and those folks who are shut in, they can't walk out, they're elderly, they have chronic conditions, whatever, you go to them. Again, if you want to, we'll test you, but only if you want to. But if they do, then you come back the next day with the results. And if they're positive, you give them all the support they need for quarantining so they do not infect other folks.
But at their home, you're not moving them anywhere?
If they wish, you could. The Congress has given the state money. You could put them up in a hotel. You could put them up in the Windsor. Maybe not the Windsor.
Must not
but
get
someplace
crazy.
else.
Yeah,
that'd be a little crazy. But on the other hand, you can put them up in a hotel and give them all the food they need. You can have nursing coming to them daily with folks bringing them food, otherwise supporting them as they get through the illness. If they get sick, bring them to the hospital. But for 14 days, you quarantine them until they're clear. And then when they're clear, they go back to the home. In the meantime, they've not infected everybody else in their house, who in turn do not infect other people. So this is, again, it's all voluntary, but if folks want to do it, it's a way to help them preserve their health, but it's also the way to help them keep from infecting other people.
And forgive me if I ask go ahead. I'm sorry, Senator, continue, please.
No, you go ahead.
I was just going to say, it all gets to be a blur, and sometimes I ask the same questions over, and I don't mean to. But in terms of testing, while you could be asymptomatic and have it, the test is foolproof, right? It will tell you whether or not you have it or even carrying it?
So there are some false negatives, so to speak. But if you're in an area which is a hot spot, the false negatives are less likely to occur.
Mm-hmm.
And what the president's team has said, if you're in an area where there is a lot of disease, that's where you're more likely going to have your people carrying who don't have symptoms. So go back to the grandmother who's 79 years old, and she lives with kids and grandkids. The grandkids, the younger you are, the more likely you carry but don't have symptoms.
Mm-hmm.
But also, the more likely you're going stir crazy and you're hanging out with your friends.
Mm-hmm.
Oh, wait, I get it from my grandmother, but I give it to my neighbor who then gives it to their grandparent? That's what we're trying to stop.
Where do we go from here with this? We've got 10 seconds. What's the next step in making this happen?
Well, I've talked to the director of the CDC. The governor's on his way to D.C. I'm speaking to folks around the state. Let's see if we can implement.
We'll talk to you again soon. Thank you, sir.